in it.
One way that you can identify the rib or costovertebral segment in question that you're trying to target is either in your prone assessment, which we've shown already. You could also do it in sitting. So if Mallory, if you go ahead and take a deep breath in, deep breath out. Good. And she's not actually, you're not having any symptoms today, no. Right? So if and when you do, one, you can like come in and like palpate. So here's the spinous process. I come off into the trough of her, the mass of her erector spinae, and in this case her rhomboids. I'm pushing through as well, and then I'm gonna come in and I'm gonna kind of just dig in just a little bit, in almost like at this angle, and that's gonna be the costotransverse, and it's not really comfortable when I push on it. When they do have like a rib dysfunction or costovertebral, they will, for several segments above and below, they will have like a reflexive muscle spasm, right? And that's where like the patient comes in, they're like, oh, my muscle's really tight. And the doctor's like, here's your muscle relaxer. And then like the uninformed provider may also just like rub on the tissue and it may feel okay, but you haven't like qualm like the reflexive loop that is actually causing the somatic dysfunction. So this would be like a gross assessment where I'm looking at her breathing. I have a general idea of where it's at, and then I could then lie her down on her stomach and get more refined there just for confirmation. And typically that's how I will do it. For all intents and purposes for our video today, we'll do it as such and sitting. And then when I come around, it's going to be the same as if I was going to go for her thoracic spine, with the exception that I need to do an additional quarter turn so that I'm like over that rib. And you'll know that you'll get the rib because it will be clunky. It will give you a different cavitation than will your thoracic spine. All right, so it's always a little bit of mental gymnastics. So if it's going to be on the right side, then we're going to have her lie on the left side of the table. For this intensive purpose, let's go just so that everyone can see. So I'm going to have you lie on the right side of the table, on your back. And then
on the right side of the table on my back.
Yep. So you're not the only one doing mental gymnastics. Your patients are too. Yeah. Now you know how they feel when you like give them the directions and then they like put their opposite leg up and you're like.
Or when you say lay face up and they lay face
My
down.
patient, I've been treating him for months, and he is still working on figuring out back or stomach, and he like will say that he's like, I don't know which one's
boy.
which.
Sunny side up.
Yeah, it's really
that's a problem.
Yeah, it's like actually kind of scary.
Okay, so we're gonna find our position of obliquity with our pelvis, one leg up, one leg down. That also gives the benefit of her like rolling over. So if you have a larger patient, then you would need to this is one technique where you can also raise the floor by having a step, but you definitely want the table to be all the way down, and you definitely want them to be all the way over you, because all the way over to you, because you really need to roll them onto that rib. She's no longer going to be like this. She's going to be like that, and I'm going to thrust through the costovertebral. It's uncomfortable. You don't want to hang out there, because they'll like start to stiffen. Are you okay here?
Yeah.
Yep.
So we're doing left rib in this position?
We are doing left rib.
Okay.
And we're always going to have the contralateral arm on top, unless there's like dysfunction at said shoulder. And then that looks pretty good. And then give yourself a nice hug. She's a little bit mobile in the shoulders. I'm going to give a little bit more. Still mobile, but we'll go with it. All right. So here's my spinous process, and then I'm going to come off, and I'm going to be right in here. And then one of my good colleagues, Taylor, he always like kind of digs in and is like, oh, yeah, and she winced at that one, right? So that seems like a good segment. So let's go with that. All right. So then I will again kind of supinate, and this is going to be. I no longer have a trough for my spinous process. It's like right on that is going to be where my thenar mass is going to be on the costovertebral. So I'm going to be slightly off the spinous process. I come in, I come over, okay, and then again I side bend, gap it, and then I need to keep rolling. I need to roll over. Big breath in, big breath out. I lay there too long, and then I thrust, and I missed it. But that's the technique, is that you want to try to get in right on the costovertebral, and it is, I don't know how you felt with it, but it's a little bit tender. Yep.
And I feel like I felt something move.
Okay. I didn't hear it, but
No, I didn't hear it either, but it felt like something you got.
yeah. Do you mind if I do it again?
Yeah.
Great.
Yep.